Everybody seems to be having the struggle, but I wanted you to tell me, what are you guys doing with respect to your staffing? Are you guys having the same challenges we're having?
So we are. I think we're all in the same boat when it comes to the staffing shortages. And I think it's just something we talk about a lot more. Like, we always had struggles, but I think since COVID, like, we really had a good understanding of what are we doing. There's a lot of nurses getting out when we were already a little bit short as it was. Not all of the programs, took a lot of GNs in the perioperative practice. And so I think it's just more of a discussion now, but we're still having the same challenges. But I think the good part is that we're doing things a little bit differently. And I think as much as we had to go through to get here, it's going to be an amazing thing that we're thinking about how do we tackle it a little bit differently. And people are more willing to hear what that is, because before it was like, what do you mean you need a residency program for OR nurses that's continuous, that always takes people in, even though you don't necessarily have positions. But now people can see that, well, if we don't have them, like, we're going to close operating rooms. We have patients that won't get the care that they need. And I think it's important now to have this on the table. So it's a lot more openness, I think, from a organizational perspective, to get ahead of it rather than kind of wait and decide later. So we're just doing some things like having more GN programs. And we had them twice a year, but now they're a lot more often. We're having them at least 4 to 6 times a year now. And we didn't always take perioperative nurses into that program. And so I think that has changed. And we are like having continuous programs now. And so I think that gives us an opportunity to continue that pipeline growing. We still have challenges around, though, who's going to teach all of them. And I think that is where we find ourselves really trying to see, what are our peers doing? What is everybody doing to try to work hip to hip with our new nurses coming into the field so that they can have the best experience and learn everything they need to do to have excellence in perioperative care. And so I think the challenge then becomes, now that we've figured out how do we get people in, if we can make sure they know what perioperative practice is about, what is perioperative services, period. Once we get them there, who's going to teach them? And how do we keep that expertise in the operating room and keep our nurses that have that tenure that can teach people how to do the work?
Are you finding that they know what they're getting themselves into, saying they want to come into the operating room? And if they are, if they're not, how are you finding that retention rate going?
I think that it depends on which schools we're talking about. There are some schools that have instructors that may have a little bit more of a periop background, and they're more apt to kind of introduce that, because it's not necessarily in the curriculum for all the schools. And I think that's one issue that we have. It's like, you can't really be what you can't see. And so if those nurses don't get an opportunity to come and just experience that or see what it's all about. I mean, I remember being nervous about it I was able to go for at least 3 days, and I knew I loved it, even in that small period of time. So I think part of the issue is they don't get a chance to see that. And so some of the things that we've been able to do with some of our local universities is they'll have like a program for their nurses that are graduating, and the hospitals can come and bring, different people and just have like a booth, and they teach them how to interview. And we all kind of work on this program, and we've done it 2 times now as an organization. And it has really opened people's eyes to what we have as options. They were able to ask questions. We were able to tell them, what all do we have to offer? What does it take to be a perioperative nurse? What does that even mean? And so I think that opportunity is huge. And if we could even start as far back as high school, I think it would change even more. But we've been able to make some changes around that, just getting into the schools and telling people about us and what we have. But we have to be the ones to say, I want to raise my hand to do that. Perioperative services is something that people need to know about. And so, it takes all of us to make that happen. So I've been really excited about that opportunity to create the momentum just for them to even know, even if they didn't get that in their piece of the program, because sometimes they get to pick and they may not know to choose perioperative services as the area that they want to go to. And maybe they don't know. They think, oh, it's just NICU, or, oh, it's just, but when they hear about the operating room, at least it piques their interest. And if we could give them a little bit, we know we'll win them over if we just have an opportunity to get in front of them.
Those kinds of fairs and things are so wonderful. Like, I remember several years ago going to one, and I had no idea, but I was like, sure, why not? Like, I'll come, let's do that. And we had a trifold. All the different departments at our hospital had trifolds. And a junior nursing student walked right up to us and said, hi, I want to be an OR nurse. How do I do it? And fast forward several years, She came to her first expo when she was still a student. Ironically, it was here in Nashville. Whole family affair. Everybody came and hung out with her. And now she went through a Periop 101 program, and now she is doing brilliantly in the operating room. So it's so amazing when you have that opportunity.
Yes.
I do want to touch on this education thing and the educators, because that's the bane of our existence sometimes, because we just don't have enough educators. I found that at my facility, one of the nice things when we are bringing in students, and it can be nurses, it can be techs, either way, because they know that these folks may very well get hired. Mm-hmm. I tend to find that the staff are very willing to train, very excited to train, impart every ounce of wisdom they have, because they feel like there will be return on investment for them, versus travelers, which we need our travelers, but they also know that by precepting travelers, they're gone in 3 months or in 6 months, and it's not really that long-term solution. So in terms of getting your preceptors and your educators, what exactly, do you guys have any really good tips or tricks that have worked?
I think one of the things is ensuring you have an educator that has the passion. And I think them understanding what the role is and the passion for what they can affect and have a good understanding of how pivotal their role is in the process, I think is huge. And so I think being able to help develop them, giving them professional development tools, helping them prepare, like going through some of the courses they have available to become certified as an educator, really teaching them, how do you train somebody? How do you identify who's even going to be a good preceptor? And them just kind of holding their ground to say, this person may not be the best preceptor for this particular employee, but this one is, because it could really make or break an experience. And so I think having a really good handle on the education program that you have and who's doing it, what the expectations are, having their passion to show through, I think has been super important for us. Also, our educators are very active in AORN, and I think using the tools that we have has been huge, because they're always searching for the next best thing, but don't have a lot of time to like figure it out on their own. And so when you can give them the tools they need to make it happen, it really, really changes the game, because then they have time to focus more on the things that they're passionate about rather than really things they don't really have a whole lot of time to do. Because when we need them onboarding, we need them onboarding. We needed people like yesterday when we're hiring people, but we want them to have the best experience. And so I think just creating the environment where they can do their work well is huge. And just really respecting that. I think a lot of times people pull the educators a lot, or they, so they don't have time to focus on creating the pipeline of preceptors and ensuring that we identify them and also celebrate them. I think that's the other thing we do well, is celebrating our preceptors. When it comes time for yearly, we go through like different types of acknowledgments for people to show, like, you've done an excellent job at Precept, and we have Preceptor of the Year every year for Nurses Week. So there's just different things like that I think helps to elevate that and show people how important that role is.
100%. I could not agree with you more. I think the other challenge that we're having with nurses is that nurses, even if we're not those folks who are like, go stand against the wall,
right,
which I find I've never seen an OR nurse who's like, go stand against the wall. I feel like sometimes we're not letting nurses be interactive enough, and as somebody who does a lot of work on policies and procedures, it's amazing that if you look at like what undergraduate nurses can do according to hospital policy, they can be involved in medication, they can be involved in opening,
right,
but we just don't give them that opportunity, because I think we as OR nurses feel like we can't,
right,
or we shouldn't. Whether they can put Foley's in obviously depends on your hospital facility, your hospital policy, but they can help prep as long as you're teaching them these skills and doing it along with them. It's amazing what you can have students do. And, once we snatch them up,
they're in.
They're ours.
Yes. So I've seen that in the past as well. And I think part of that is, as an OR nurse, like, you feel so just connected, and you feel like really everything lies on you to protect your patient, make sure everything's done perfectly and correctly. And sometimes you don't feel like you can give any of that up. And so I think that is kind of how we've got into something like that. Yeah. But I think the part about it that is important to know is that when you were a nurse and you got to touch things, feel things, do those different simulations, work in those labs, learn how to do things, that's where you really learn to love that art of nursing. And I think that's where people would learn that art of love and perioperative nursing as well. If they're able to get in and understand, touch and feel things with their own hands and see how much of an impact they have on this patient's outcome, that will change things.